First off, thanks, Rebecca. I appreciate your time today. And Terry, thanks for joining me. We're very excited because, as Terry mentioned, the mushroom that we work with is called Amanita Muscaria. It's the red and white mushroom cap. Just got a little prop here to show you, but most people will recognize it. It's the emoji on your phone. It's been popularized by pop culture, whether it's in the movie for Alice in Wonderland or Super Mario Brothers game. But it's widely misunderstood. So it's been mislabeled as a poisonous mushroom. And that was the opportunity for us. We did the work and we identified it as not being poisonous. And if you do the proper extraction process, you can actually convert one of the toxins, one of the compounds that can cause a nasty effect. You can convert that to Muscimol, which is the compound that we're after. So we actually, we rolled up our sleeves, we did the work. And as a result of that, we have a very unique opportunity, being the only company studying Amanita muscaria and specifically Muscimol. So we're very excited about it. As you mentioned, we're in preclinical trials. The reason we started with preclinical is, again, we're the first company to do the science. So we have to do that foundational work that other companies, our peers, are able to sort of rely on the historical work that has been done through the science community. We don't have the benefit of that. So we're really doing everything from the ground up and providing that strong foundation for us to then be in a position to take our extract that we've come up with and market that to commercialize products in the first half of 2022. We'll be applying to the FDA for a new dietary ingredient and to Health Canada for a natural health product number. So we're very excited. As Terry said, I think we've got a great opportunity and a fantastic team.